Greetings, Eric Bakker, Naturopath from New Zealand. So we come to our last video in the series of Pseudomonas. We're going to talk about the best treatment, especially the dietary supplements. What are some of the key things you can do? Well, to begin with, if you found Pseudomonas in a stool test, the treatment would be different than if it was found in a blood test. If it was found in a blood test, you'd probably be in a hospital setting, getting an intravenous antibiotic. If you're in an operating theatre and then going into post-op and they discovered it, again, they would give you antibiotics. So if you've picked up a hospital-borne infection, well, basically you're under the control of the medical system. There's not much you can do. But if you're at home and you've got an infection and you found it through the stool test, or if you've had a skin swab taken or an ear swab taken or eye checked out, if you've got an infection topically on the body, you could try colloidal silver. That works quite well. I find that works very well indeed. My favorite colloidal silver company is a company in Utah called Silverbiotics. Silverbiotics. They make a really nice, let me see if I got it in for you guys. They make a really nice spray, a beautiful spray. This one here, Silverbiotics. I like this product. So you could again spray that, for example, on a on a cotton bud, put that around the eye, or you could use an eye bath, which is better. Boil some water, let it cool down, and then put several drops or a few squirts, sprays of that colloidal silver in there, and rinse the eye with that. Colloidal silver works very well for eye problems. You can also get a colloidal silver cream or a spray for the skin, and you can also use colloidal silver internally for urinary tract infection. So think about that. That's one good way of treating the urinary or the skin or things like that. I would certainly be looking at why you've got this Pseudomonas infection. So you may want to have a look at your immune system, maybe get a blood test done, maybe do a salivary cortisol test to see where your cortisol levels are at, or in the adrenal production. Cortisol is important. If you've been under stress or got an adrenal problem or thyroid dysfunction, that could be impairing your immunity, increasing your susceptibility. So those things need checking out. Internal treatment, I would be recommending grapefruit seed extract for Pseudomonas, particularly when you combine it with berberine and a good garlic extract, and you put other bits and pieces in there. These things are going to work as a broad spectrum. You're going to get a lot better effect on that than you will just by using just one particular item. I don't want to, again, promote my own product, but I'm going to anyway, shamelessly. Go and have a look at the Canxida Remove product. This product here, and the reason I'm saying that is because it's been used very effectively now for hundreds of cases of Pseudomonas and Citrobacter and other bacteria. It's been used in many, many cases now positively for eradication of these bacteria. We've definitely seen great results pre and post testing with Canxida Remove. If you don't want to use Canxida Remove, get a grapefruit seed extract. But as I mentioned, a broad spectrum product will work more effectively. Don't forget to use a probiotic. When you start taking Pseudomonas down, you want to start building Lactobacillus up. And very commonly in a test we find the beneficials will be down and the Pseudomonas and Citrobacter will be up. So we want to get these guys down and get these guys up. And again, check out Canxida Restore, the green product with the green label. We've got several enzymes in there and several probiotics. So the enzymes will assist also in eradication of bacteria. They help to bust open walls of bacteria. They help to destroy bacteria. They help to change the pH of the environment, make it conducive for good bacteria to thrive and not bad ones. So that's going to go in your favor as well. And of course there are beneficial bacteria in there which also alter the pH of the gut and make it better for good bacteria to grow. Generally, when you take these products for Pseudomonas, you only need to take them for about maybe 6 weeks, maybe 8 weeks at the most. But as long as the diet and lifestyle are in line with this kind of treatment, you should get a very good result. So make sure that you read more of the articles on yeastinfection.org, check out the videos on this channel, familiarize yourself with that content, because when you live this kind of lifestyle, you've got a great chance of getting on top of the Pseudomonas infection without having to resort to crazy drugs like ciprofloxacin that basically undermine your health. See, I wouldn't wish that drug upon anybody. It's terrible. The Cipro, what it's done to so many of my patients, it's actually disgusting. So there you have it. That's the series on Pseudomonas aeruginosa. Don't fear this bacteria, but if you have got it, it needs treatment. Right? It needs treatment quick because it can cause a lot of problems. Thanks for tuning in.